Father.
Hello, it's nice to meet you, daughter.
So nice meeting you also. I'm busy coloring my her other daughter's hair, but we're on this. Thank you so much.
Does it come on suddenly and grip you, or is it progressive? What causes it?
It's mostly when I turn over in bed. It is
Okay.
excruciatingly hard for me. And in fact, I'm very careful in trying to turn over in the bed just to keep it from hurting, and it just does. It's a really stabbing, sharp pain when I turn over in bed.
Okay, let's talk just about that. Not the weakness, not the everyday, just the pain you have in bed. It's on the left side or the middle or the right?
The left side, where the glute is.
It's where the glute. So if you were standing and not in bed, it would be where the back pocket of your jeans are.
Yeah, probably.
Okay, and does it radiate out from there or does it hurt right there?
It just hurts in that one spot.
Okay, but this is your sacroiliac joint on the right, and this is your sacroiliac joint on the left. And the one on the left is so arthritic that we can't even see the whole joint.
Oh.
So you have severe sacroiliitis on the left side, and that is what is causing your pain at night.
Gotcha.
You also have a little bit of spinal stenosis. You have a little bit of spinal narrowing. It's hard to see in people with scoliosis, but pain is always the thing that wrecks everything, right? Pain ruins everything. So yeah, let's get rid of the pain and then see where we're at with the walking, because it could be that because her sacroiliac pain is acting up so much that she can't walk right, and that's what makes her feel tired. And that kind of pain, that sacroiliac pain, the best there's neurosurgeons and orthopedic surgeons and physiatrists and pain management anesthesiologists and physiatrists and chiropractors and naturopaths and neurologists. There's literally like 10 different kinds of doctors. But the doctor that does a really good job with sacroiliac pain out of all those 10 is the chiropractor.
Really?
Yeah, it's like the best use of chiropractic treatment. Chiropractic's terrible for herniated discs and a lot of other things, but it's fantastic for this, because the problem is the alignment of that joint and then the way your hip is interacting with it. So really the next treatment is to find a good Palmer trained chiropractor who can address your sacroiliac pain, get you out of pain there, get you moving again. And once that nighttime pain is gone, if you're still having the leg pain, then you need an EMG, an electromyogram from a neurologist to explain what's going on with the nerves in the legs. Because it seems like they're not working right and you're feeling overly tired and all this other stuff is happening. But it's really not, I would expect to see worse back to be causing this trouble.
And it was recommended that she go to a pain management doctor for injections.
Yeah, I mean, the only reason to do that would be to get a diagnostic sacroiliac injection. So when you go to a pain management doctor, most of them, because they see patients with a wide variety of problems, they follow a protocol. And the protocol is you get 3 epidural injections, then you get medial branch blocks for the joint pain of the spine. And when they see your x-ray with the scoliosis, they're going to really want to do that. And then when all of that doesn't work, they get down to doing a sacroiliac block, because that's actually what hurts in you. So I think it's going to be a lot of squeeze for not much juice. I really think you might consider just going to the chiropractor. But pain management doctors are, board certified in anesthesia or physiatry, who specialize in pain, are very skilled doctors and people you want on your team. But I kind of think of it, are you a baseball fan?
Oh, yes, and Phoenix Suns too.
Yeah, me too. Me too, especially the Suns. Well, so I feel like, you need a good third baseman, but if the ball's hit to the shortstop, at that time, what you really need is the shortstop.
Yeah.
And that, yeah, you need a pain management doctor that you can rely on if you ever get to that. But what you need right now, first and foremost, is a chiropractor.
I tried the chiropractor.
Yeah.
And I have a good one that's been recommended to me by a friend. Yeah.
How do you,
Okay.
Psychologically, I have been in good health for so many years that part of me is recognizing the fact that I'm aging and things aren't working as good like they used to. And I think that's part of the persona that my daughter sees, that I'm, upset and about, what's going on with me.
yeah, who wouldn't be?
I
I know I've spent my whole life surrounded by nurses, so I get it. When you when you've been taking care, when your thing is taking care of others,
Oh yeah.
you kind of learn to not take care of yourself, and it can make you feel uncomfortable. And that's normal and natural, but also not relevant. There's something wrong with you and it needs to be fixed. And even though you were a good person and a sweet mom and you took care of others and your daughters obviously love you, you deserve to feel better too. So,
Thank you.
so let's get this thing fixed. And you haven't had any treatment so far that could help.
No,
So,
it's been
no.
physical therapy.
Yeah, I mean, they meant well, but it's
Should I
the
continue PT?
I mean, there's a lot they can do for you, but I would ask you to tell them you have sacroiliac pain and to teach you sacroiliac stretching exercises that you can do at home. You've got a good chiropractor. Why don't you start that, and if it works, send me a Christmas card. If it doesn't, call me back and let me know, hey, this isn't working. What are we going to do next? And we'll talk about that.
Okay.
Thank you so much.
So you're gonna.
Oh, you're welcome so much. What about the other daughter? The one with the beautiful new blonde hair? What color are we now?
We're a medium brown.
A medium brown. I want to shake your hand, but you can't.
You're welcome, Sherry. Nice to meet you.
Nice to meet you. Thank you so much.
Bye now.
Bye. Oh, that's so good.